when you look at pulmonary hypertension, that's what we're talking about, right? Because pulmonary hypertension leads to cardiac failure. When I look at that and you look at the human literature, there are 5 types of pulmonary hypertension. The big one that we're going to look at is group 3, meaning group 3 pulmonary hypertension, if there is a problem with the lungs, and usually it's chronic hypoxia. Remember, let me define that word hypoxia because I'm going to use it. Hypoxia means that your body is not getting enough oxygen. There are numerous reasons for that, right? If I go and hold your nose and mouth shut, you're going to become hypoxic, right? So that's what, when I say that word, just keep thinking, that's because I don't have enough oxygen, and what is going to happen to my body when that takes place? And that's what we have over here in the group 3 session, right there. This is the slide that I want to spend the time on. Because here's what you have to think of. When you're raising an animal, you're doing a pap test, you're doing whatever you're going to do to that to try to stop this cardiac death or this whole pulmonary hypertension. I want you to look right up here at alveolar hypoxia. Okay, alveolar means lung tissue, right there. Alveolar hypoxia, meaning that the tissue in the lung is becoming hypoxic. Why is it becoming hypoxic? The etiologies or the reasons for that go on and on and on. The one we're talking about today is altitude. Okay, but remember, if they have pneumonia, if they have AIP, if they are all the different reasons, that's what we're looking at. Anything that starves the lungs from oxygen is what's going to initiate this thing. What we're going to do is we're going to go through this, so we're going to have sleep apnea, we're going to have whatever it takes to make you hypoxic, because the next thing that's going to happen when you have alveolar hypoxia, this is what happens. So picture this, and I did this for some of you yesterday. You have vessels in your lungs that are sitting like this, right? When you come up here, Kentucky, thank you to my friends from Kentucky coming up. When you come up to this elevation, your lungs are going to pick up, I am hypoxic, right? You, in this elevation, you become hypoxic. We are sitting there today doing this. So when you become that, your lungs become hypoxic, your blood vessels are going to shrink, right? Here's us. Whoop, wonk, wonk, wonk. They shrink, they almost pump, because when we breathe in, we have more oxygen in the top of our lungs than we do in the bottom of them. So our body goes, why are we going to push blood through the bottom of our lungs when the oxygen's at the top? So we are going to shunt. This is called shunting. We're going to push blood from the bottom to the top where it can become more oxygenated or get more oxygen. So we do this. Humans, wonk, 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 wonk. Alpaca, wonk, 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 wonk. Okay, yak, brr, brr. All of them do this with very elastic tissue, right? Here is bovine. Wonk, down to nothing. So we call that hyper-responsive. They don't have the elastic shunting, right? It all squeezes down and then it doesn't reverse. The problem with it is that is the heritable condition in cattle, how fast they will do that. We call it hyper-responsive. We are looking with the pap test, the blood test, whatever we can, that we're here to meet and decide what we're going to do and try to advance, is we're going to try to predict those animals that do this walk shunting very out of control. That's what cattle do. So if we look up here, that's what this is. They're going to go into vasoconstricting and then the remodeling. Remember, the humans don't remodel. They bounce back, bounce back, bounce back. The cattle do not bounce back. Boom! They stick, and then the vessel starts to squeeze down, which I'll show you pictures of. So the heart is going to pump 1 gallon of blood up into the lungs. Boom! Pushes 1 gallon of blood up into the lungs. What happens if we go through remodeling, the blood vessels in the lungs shrink down like this, all of a sudden that 1 gallon of blood cannot fit, right? Does that make sense? We've shunted down. We cannot get the 1 gallon of blood into the lungs, so consequently, the heart tries to push harder. It knows it has to get blood into the lungs to get oxygen, so it goes through this muscle thickening called pulmonary hypertrophy. The muscle's got to get thicker and thicker, and if that 1 gallon of blood can't get into the lungs, hence we have pulmonary hypertension. And that heart is going to work and work and work to try to overcome that until finally it goes into right ventricular dilation and death. So you have to remember that this part right here is where the genetic influence is to cause this whole problem. So remember, who saw the pap test yesterday? right? We stick that catheter down. Beautiful. We stick that catheter down. Here's a PAP of 40. That's the vessel on its side, so that's the lumen where the blood goes. Look at a PAP of 80. Can you see this? Wonk! You can now see right there how thick that vessel has gotten. So if we go on this side, same thing. These are normal, right there, and those are ones with an elevated PAP. And if we look at this one, this is one on the end. This is, see all the white fuzz? Shake your head if you can see the white fuzz right here. All that is capillary network in the lungs. That's the vessels that are normal. When we start shunting down, wonk, like that, this is what that looks like. So when you get to that, there's nowhere for the blood to go, right? So it starts to back up into the right ventricle, and they go into the congestive heart failure. I know this is a quick trip through physiology. So when you start to see these creatures, what happens, this is an example of what all the things they have. Look at this little guy's jugular vein right here. It's extended. This little guy has congestive heart failure. Why? Because the vessels have all shunted down. He's a genetic carrier. He actually got the disease, and he's going to die. So this is an example of how devastating this can be. If you get genetic carriers of this, this is a herd of 435 calves. 117 of them died before the age of 6 months of age. They died of congestive heart failure. They were free of pneumonia, free of all the environmental causes, and simply died. And when I look back, all of the dead calves came out of 2 sire groups. Okay? Bovine hyperreactor. These are just the animals that are moderate reactors and, of course, low reactors. I put yak on there because yak do the opposite thing. As they actually go up in altitude, yak's PAP come down because their lungs become more elastic, more dilatory, and they are actually survivalists. So the yak is probably the one, and alpaca. They do the exact same thing. So that's just a girl that has the brisket edema. Remember, I said yesterday the pressure gets so high, it blows the fluid out of the vessels, and it sinks into the bottom of the chest like that. So here's some hearts. I put this on here for our friends from Kentucky. Here is a normal heart right here, and this is a grade 4 heart. What does this grade thing mean? We wanted to be able to track how much of this is actually happening in the feedlot at lower elevation, because it used to be when I started this many, many years ago and started having fun with it, I never saw high altitude disease below 6,400 feet. I moved to a place that was at 7,800 feet so I could do research and play with this disease. When I use the word research, that's probably a little harsh. I would say where I moved where I could play with the animals, right? So I spent much time petting them instead of researching them. But this is a heart that's blown out. See that little black hole right there? And I'll show you over here. This is a normal heart right here. And see that little black hole? This is a grade 4. That heart right there is about to blow an aneurysm. The pressure is so high in this animal, that is going to blow. If this animal doesn't die of brisket disease, it's going to fall over because of a pulmonary aneurysm from high pressure. And so when we look at this, this is grade 5s. This is total cardiac collapse. This is at the very end of that chart. The heart has absolutely zero function at that point in time. If you're a human and your heart looks like that, you have to go on a heart transplant program. You have to go on an artificial heart. Your heart has no function. This is what's happening to the cattle as we go across. How heritable is it? It's very heritable. I'm not going to even use that word like I know what it means. I'm going to let the geneticists talk about heritability. But remember, I track sires with the PAP, right? That's what I do. I go and stick them. I look and say, wow, this sire group has all this potential for a high PAP, and therefore I'm going to draw the conclusion that that sire may not be good for use in altitude. That's how I utilize the PAP test with this.
There's a couple of characteristics that you can think about when you think about how cardiovascular function works. First of all, the heart is basically, it's not a very cool way to talk about it, but it's a muscular bag. It actually has no ability to generate suction as a pump. Many of you work with pumps in what you do. Those pumps can prime themselves, right? They can suck fluid in before they push it out. The heart can't do that. The heart is entirely dependent on that elastic vasculature all those blood vessels stretch out a little bit. And once the heart relaxes, that stretched out blood vessel will push blood back into the heart. One of the ways we'll talk about in a minute when it fails is when that can't happen. The other thing is that that muscular bag can actively shove blood out when it contracts, but it can do it because there's check valves in the system. There's basically backstops that prevent the blood from going backwards while that muscular bag shrinks and shoves the blood out, hopefully downstream. Get a lot of pathology when that doesn't happen. Next thing that's important to remember, and Dr. Hold already mentioned this, is there's two circuits. We have one that's going to the lungs in order to reoxygenate blood, and then the other circuit is going out to the body and the organs, muscles, things like that to provide those nutrients and remove the waste. Every heartbeat has to have about the same amount of blood going both directions in order for it to stay in balance. So if you think about how much body there might be compared to how much lung there might be, there is a lot of blood that has to go through those lungs and through that right side of the circulation. Part of the way it does it is that the right side, when I talk about right side, that's the part going to the lungs, left side is going to the body. The right side circulation is supposed to operate at a lot lower pressure than the pressure that goes out to our bodies. There's three big ways that this system can fail, particularly the heart can fail. One is the failure to fill. So if we block in this little, I'm not going to be very good at being able to show you what's going on, but basically those little black bars represent a blockade to filling. Interestingly enough, most of the time it's not a blocked vessel that prevents the heart from filling with blood appropriately. It's fluid or something that accumulates around the heart itself. Examples of this would be hardware disease. So when that wire goes through the diaphragm and pokes into that sac that's around the heart, what happens is it puts bacteria in there. That generates an immune response that brings pus into that pericardial space, and the sac that's around the heart is pretty tough. It's not near as flexible and stretchy as the heart is. So as fluid builds up in there, it pushes in on the heart, and it keeps that blood from being able to flow back in and fill it up. So blockade to fill can also happen from things like lymphoma. I don't know if you've ever seen a cardiac lymphoma. I found one of those in my career, and it's one of those things, when a vet says, ooh, that's cool, as a producer, you should be very concerned. All right, the next one is blocked outflow. This, I'm not gonna spend any time on this other than to say it, because this is basically what Dr. Holt was talking about. When the lungs constrict, you can't get blood past it, and that will put a lot of pressure on the system and eventually make it fail. And then you can have just absolute pump failure. So we actually understand this pretty well too. Most producers have seen things like cardiac histophalosis. I don't know if you guys have ever seen that in your cattle, hopefully not. Or if you see rumensin intoxication, that will be damage to the muscle itself that results in the pump actually not being able to generate enough force to move that blood out. This is basically a summary of some of those causes. So I've gone through all those. High elevation and chronic BRD. If you get a chronic pneumonia case, those can cause that outflow blockage. Hardware lymphoma can cause the failure to fill. Ionophores like rumensin or lasalicid can cause that damage. And then some bacterial diseases like even blackleg can damage that pump itself. And then we've got this other one. This bovine congestive heart failure is what we call it, this thing we see in feedlot cattle where they, sometime between placement and finish, they do us a grand disservice and kick the bucket. So we do know some things about the progression of heart disease. There's quite a bit of work that's been done on this, and one of the most challenging things about heart disease is that in order to know when the insult happens, we have to figure out what the insult is, which is kind of that's the holy grail of research. So what we think happens is that there's an insult, and we have some evidence for this, but insult could be go up to 10,000 feet of elevation. The insult could be get a big old dose of rumensin in a load of feed that maybe didn't get mixed very well, or develop a case of cardiac histophalosis, something like that. After that insult occurs, the heart has a tremendous capacity to compensate for that damage. That heart can For instance, if the heart is surrounded by fluid that's preventing it from filling it appropriately, the heart will actually make up for that lost pumping capacity. Its stroke volume, the amount of blood that leaves every time the heart beats, is down, so it beats faster. So instead of beating 10 times in a certain period of time, it'll beat 20 if it's got to move the same amount of blood. So there's that compensation phase, and part of the compensation that we see in cattle is their ability to build muscle in order to overcome some of the problems that they're experiencing. So at elevation, cattle will actually build cardiac muscle mass to make the pump stronger so that they can push that blood past the obstruction in the lungs. And we see this compensation, and one of the things that our team wrestles with quite a bit, we talk a lot about, do we see different grades? So I've got a picture, and you'll probably see this, I'm certain you'll see this again, but the heart failure scores are out there. And when we look at these heart failure scores, we've asked ourselves the question, are we seeing a different timing situation where we've got an animal, particularly when it gets to harvest, it didn't die on its own? Are we looking at different stages of progression, or are we looking at different severities of disease? And I don't know that we have ever come up with a very good answer for that. The other thing is that I see pressure generated by the heart is something we can measure. And when we look at a case of heart failure, you'll see the red line in this graph. This is completely made up, by the way. I drew that line myself. That's not data-based. It's designed to represent what's going on and what has been measured. But as the heart fails, cardiac output, the amount of blood it can just move in total, goes down. And it starts going down more slowly, and that rate of decline gets faster, so they're moving less and less blood as disease progresses. But there's a period where we don't notice it that much because they're compensating. And that pressure curve that you see there is designed to represent that compensation. The heart is like, well, we got to build muscle, push harder in order to make sure that we can get that blood circulated around, make sure the relay handoffs are happening. But there comes a point when the animal decompensates and can no longer keep up, and that's when we start to see clinical disease in these animals.